Hormones can impact every aspect of our lives, and if we don't understand how they work, we won't be very successful in keeping them balanced. Welcome to another episode of the Mental Health Break. Dr. Brandi Moore, a naturopathic physician, joins me to discuss all things related to hormones. Hi, I'm Dr. Nafisa Sikandri, a licensed clinical psychologist specializing in anxiety-based disorders. I created the Mental Health Break podcast to give you simple, actionable, step-by-step strategies to help you prioritize your mental health. Mental illness can cost you time and money. Ignoring your symptoms will only make the problems worse. Taking time out of your busy day to dedicate to improving your mental health can lead to long-term health and wellness. In this podcast, each week you'll learn tips, tricks, and proven strategies to help you regain control of your life, all while prioritizing your mental health. If you want to improve your life, regain control of your mental health, and feel empowered, you're in the right place. Let's get started. Today's episode is brought to you by the Transforming Anxiety course, an online, self-paced anxiety course to help you manage and control your anxiety from the comfort, privacy, and convenience of your own home. Learn how to transform your anxiety in just 6 short weeks. Course registration is now open. To learn more, visit transforminganxiety.com/course. I'm so excited to talk to Dr. Brandi Moore about the importance of hormones and their impact on mental health. Let me briefly introduce her before I bring her on. Dr. Brandi Moore is a mom, a wife, a naturopathic doctor, a mentor, speaker, and host of the Pretty Healthy podcast. She specializes in women's health and helps them rebalance their hormones, get their energy back, and lose weight. It's her mission to help women understand their bodies and advocate for their health. Welcome, Dr. Brandi Moore. Thank you so much for being here.
Thank you for having me.
I'm so excited to talk to you. I just briefly introduced you and gave a little bit about your background, but can you give us some more information about your training and then the people that you serve?
Yeah, so I'm a naturopathic doctor, and I attended the naturopathic school here in Tempe, Arizona. A lot of our training is just very integrative and holistic. So I learned all of the conventional, pharmaceutical treatments and procedures and kind of standard of care. And then on top of that, I learned herbs and supplements and nutrition and, how to take more of a holistic approach when treating patients. So I did that. And then right now in private practice, I'm mostly serving women and men with hormonal imbalances. So kind of 3 pillars of my practice, I would say, are skin, hormones, and digestive health. And a lot of those are because they're so intertwined. You know, if you have a hormonal imbalance, you can very well have things like acne. And then if your digestive system is off, it can also lead to things like acne, but also, stress and hormonal imbalances and things like that.
That's so interesting. I've actually gone to the Naturopathic College in Tempe. Is that the one on Broadway?
Yes. Southwest College of Naturopathic Medicine.
Yes, I refer a lot of my patients there if they want to get a more holistic approach to physical health. So that's really cool that you graduated and that you're local and you're in Arizona like I am.
Yes. So I graduated from there and then did a residency there as well. So, and then now I teach as adjunct faculty. So very intertwined with the SEM community, but it's a great place. And especially if patients want to use things like insurance, there are some options there that typically in most private practices aren't there.
Yeah, no, it's a great place. And it's a great resource for people. And they can also find they have a medicinary, they can find a lot of the natural supplements there as well. So on the Mental Health Break podcast, I've had several people come in and talk about hormones and the importance of hormonal balance. But one thing I wanted to get into today is, and that we haven't really done, is hormones is such a big word, right? It's such a huge umbrella, and it affects, and some women might think it's just for women, and men might think, well, I don't really have hormones, I don't have to worry about it. But men also have hormones, and it includes more than sex hormones. So can you talk a little bit about what hormones are and how do we know if they're imbalanced?
Yes. So a lot of times you're right. We think of hormones as this big umbrella word, and what exactly does it mean? So hormones control most of the processes in your body. And when you see a specialist like me, what we're looking at is the thyroid. So the thyroid releases thyroid hormones, the adrenal glands, which are responsible for the release of stress hormones, in addition to those sex hormones you just mentioned, as well as the sex hormones. So in men, the predominant sex hormone is testosterone, but men also have estrogen and progesterone. They just need it in a different ratio and balance than women do. And so for women, we often look at estrogen and progesterone being, I would say, the most dominant controlling hormones, and then having testosterone play a supporting role in that for kind of that picture. Some of the symptoms that you can see if you have hormonal imbalances, there's a lot of overlap, right? So if we're talking about thyroid hormone first, you can see depression can happen with low thyroid, fatigue, constipation, dry skin, dry hair, hair loss. All of those are very common with the thyroid. If we're talking adrenal glands, specifically cortisol, right? The one that's responsible for our stress hormones, you might notice anxiety. You might also notice changes in energy. So fatigue, what's typically referred to as like wired and tired. So I'm tired all the time. I'm just utterly exhausted. But when I lay down and go to sleep, my brain just goes. And there's nothing I can do to kind of shut it off, or it takes a lot to shut it off. Oftentimes that is that wired and tired adrenal health picture. And then when we talk about the sex hormones, in men to often think like, I just don't feel like myself. Like I used to be able to, I was really mentally sharp. I was clear. I could remember things easily. I could perform well at the gym, and I could see results fairly easily there too. And they hit a point where it's just like, not only is that not working, but I emotionally don't feel like myself. I feel like a dulled version of myself. For women with sex hormones and those depleting, you can often see things like same mood changes can happen, right? Irritability or depression, kind of either on that scale. You'll often see menstrual cycle changes in women when those hormones are off. You can also see fatigue. You can also see decreases in libido, same as what we typically think in men. We can see stalled out weight as well, like whether that be gaining weight or inability to lose weight. So there's quite a wide variety and like range of symptoms that you can experience. So just the term that like hormones are off, you really do have to find someone who can investigate further with you and see what it is, because there's some overlap, but there are some key things that can let us know if it's one thing or another.
Yeah, that's such a good breakdown. And that I have an example of one of my patients who was feeling exactly like you were saying, because for women, our periods being off, menstrual cycle being off, weight gain, those are some clear signs. But for men, it's not so clear, right? And so I had this one patient who's just like, I think I'm just overworking. I think I'm just stressed. My wife keeps complaining that I'm not doing enough. I feel lethargic. And sure enough, he got his thyroid tested and his thyroid levels were low. And within 2 weeks of getting on thyroid supplements, he ended up feeling so much better. And he's like, I haven't felt like this in so long. And that's the sad part about it, is that a lot of people don't know what's happening. And so they will maybe drink too much or consume too much caffeine, just trying to get through whatever without really knowing exactly what's going on. And that's why I focus so much on hormonal balance, even though this is a mental health podcast, because a lot of the symptoms, I have a lot of women come to me between the ages of 35 and 50, and they're automatically put on antidepressants and anti-anxiety medication, and they don't even bother to stop and say, maybe it's something else. And we need people like you, a doctor like you, that can look at the whole picture and give them exactly what's going on.
Well, and like you were saying, it's just, number one, sometimes we don't feel like we have a safe space. Because sometimes, and I've had this experience personally before I became a provider, you go to a physician and you tell them your symptom, and then it's like, oh, it's because you're older, or it's because, well, you're working a lot, or you're a student, or there's always an easy kind of like brush off reason that they give you, like, that's why. So you're fine. And so we go through life thinking that certain things are just normal, that you should have to drag through your day, that you not wanting to get out of bed, it must be that you're depressed and you need Lexapro, when maybe your adrenals or your thyroid are off and you just need help because they control your energy production. Like there's a lot more to treatment from the way that I like to do it in my perspective than you're fine, here's a pill that should work.
Right. And a lot of us are under a lot of stress right now, whether it's from work, from financial stress, from the fear of uncertainty. And You mentioned cortisol and the adrenals and how they affect us, and our releases our stress hormones. Can you talk a little bit about, like, stress affects us on so many levels? It's literally the one thing that can literally kill us if we're not careful. Can you talk a little bit about what the role that stress plays in depleting our hormones and what we can do about it, if anything?
Yeah, so there are things that we can do, which is nice. But we first have to recognize that that is kind of the main issue, which is why often with my patients, I start with labs. So there are ways to test adrenal health. You can do like a cortisol ×4 or a salivary cortisol. So your physician that you see should have access to those tests that you can get an estimate of what you're producing in a day. But oftentimes you can go with the stress hormone specifically with symptom picture. So most of my patients, I ask, what's your stress scale of 1 to 10? I ask everyone. So it doesn't matter if you're coming to me for acne, for GI distress, for bloating, you're getting asked about your stress, you're getting asked about your sleep, you're getting asked about your diet. Like, we're going into it, all of those things. So when I ask about stress, I'm like, okay, rate your stress scale 1 to 10. Well, I don't know. I'm not really stressed. And I'm like, okay, well, what do you have going on? Well, I mean, work is kind of stressful, and like my kids and my home and my husband. And like, the more that they talk, I'm like, how are you rating your stress a 3? Like, all of the things you just mentioned, you're at least a 7. Like, on the range of 10 is the most stress, right? And 1 is the least. With all that you're telling me and all that you have going on, you're for sure not a 3. But what we'll start to see is they'll report it that they're not stressed, because we think of stress as anxious or feeling overwhelmed. But if you get to that point, you've been stressed for a while. So oftentimes I'll have them rate their stress, and then I will go into kind of their symptoms. So what can happen is cortisol being high and your adrenal stress being off, you can affect both the thyroid and the sex hormones. So with the thyroid, you will convert T3, which is our active thyroid hormone, to reverse T3. You basically make your active T3, the one that's responsible for all of the tasks, unusable. And once you do that, you start to present with symptoms of hypo-thyroid or underactive thyroid. And those things are some things that I mentioned earlier, but that constipation, fatigue, cold intolerance, dry skin, hair loss, you will start to get those symptoms. And oftentimes, conventionally, they just order a TSH with reflex, right? So TSH is the signal from the brain to the thyroid. It tells it to make more thyroid hormone. They just test that one signal. And then if it's anywhere within the range, which is quite large, then you're normal and everything is fine. So I like to take it a step further and actually test T4, T3, and in certain patients, reverse T3 to see, okay, well, we're making T4, which is one of the thyroid hormones. So that looks great. That would make it to where it wouldn't show up on the standard test. But we're not making T3. And when I test that reverse T3, it's high. So then we're doing things to balance stress out. From a female hormone perspective, what will happen is in times where we need a lot of cortisol, our body will say, well, I don't need to support my sex hormones right now because I don't need to have a baby, right? Which is the whole reason why we have the cycle that the way we have it is for reproduction. I don't need to do that, but I need to manage stress. So it will take one of our sex hormones called progesterone and convert that to cortisol. And what that does is that depletes our own progesterone. So we start getting symptoms of estrogen dominance and low progesterone. Our periods might get shorter and shorter, or like closer and closer together. Another thing that you might notice is that, again, the weight gain, inability to lose weight, headaches, depression, anxiety, all of these things can come just from cortisol stealing really that progesterone that's needed for the sex hormone pathway. So stress can kind of cause everything to go a little bit haywire, and it's all undone once we start to deal with our stress. So oftentimes we can't change jobs, right? Not everyone has that opportunity or that privilege to just switch careers on a whim or change husbands on a whim. And most people aren't just like, well, the kids got to go because I'm stressed. So what we can do is support those adrenal glands and their production. So I really like to use herbs with this. Some of my favorites are like ashwagandha is a really great adrenal adaptogen. Rhodiola is another really great adrenal adaptogen. So with my patients, I use a combination of herbs, and I try to tailor it to their needs. And then getting good sleep, meditation, deep breathing, journaling, all of these things can be ways that you can handle and manage your stress. Things like caffeine can tax the adrenal glands. So limiting that as well.
One of the best advice I heard was a lot of people start, like I don't drink coffee. I've never even had a cup of coffee. So I'm not one of those people. But I know that a lot of my patients are highly dependent on caffeine. And the first thing they do in the morning is regardless of what time they wake up, they have caffeine or a cup of coffee. And for some of my patients that I've actually encouraged to delay that coffee to 10 o'clock instead of first thing in the morning, it's made a huge difference for them. Can you speak a little bit about that? Because our cortisol levels, we're synced with the setting and the rising of the sun. So in the morning, we're supposed to have high cortisol to wake us up, get us out of bed. And then on top of that, we're drinking all this caffeine, which is increasing cortisol and our stress response. Can you speak a little bit about that and why it makes sense to delay that coffee to 10 o'clock instead of first thing in the morning? Or if you even believe that.
Yeah. So usually what is supposed to happen, you're absolutely correct, is that cortisol is supposed to spike in the morning and wake us up. And then it slowly will decrease throughout the day. And then it kind of hits more of a low plateau in the evening when melatonin is supposed to rise and take over. So if you have any issue between that cortisol melatonin balance, you will have issues with sleep. The issues with sleep will then cause issues waking, right? We aren't getting that same spike in cortisol that's going to help us to wake up and be alert in the morning. I don't have patients delay their caffeine, so I'm not quite sure then what's kind of going on. What typically happens with caffeine is it just depletes those adrenal glands. It's this really vicious cycle. So drinking caffeine will make your energy better in the short term, but in the long term, it actually taxes the adrenal. So it makes you more dependent on things like in females, our progesterone to make more cortisol to keep up with that. So normally I don't take away people's caffeine straight away. And the reason why is because they're relying on it for a reason. However, if it's causing things like anxiety and it's making your anxiety worse, then you have to kind of figure it out. So I will start having them either switch to like tea or decrease their caffeine intake once they start to get the adrenals on board. So oftentimes if I start with herbs, then what you'll tend to notice is they just don't need the coffee as much. So they'll be able to wake up, they'll be aroused and be able to do what they need to do. And then they will notice that they kind of go through the day and they might have been drinking 5 cups of coffee and it'll go down to 3 because they realize, oh, I just don't need those extra cups anymore. And then we typically will get them down to the 1 cup. What might be happening though is in the morning, typically you're getting that cortisol spike, right? So they might be getting that initial spike. They're so used to reaching for the coffee in the morning, that could just be out of habit. Oftentimes, most of the time, if we start to feel exhausted, it winds up being in the time that you're saying, right? You can typically make it the first 2 to 4 hours of the day without needing to rely on caffeine, but the dips start to come at about 10, I would say, like 10, 3, and 6 or 7 is where I notice it with patients when I do their cortisol curve. And just with speaking with them. So you might be getting them with that caffeine burst, just like right at the right time at 10 a.m. and allowing them to rely on their own natural cortisol production in the morning. And then kind of when they start to feel that crash, that you're getting that uplift from the midday or mid-morning caffeine.
Yeah, I agree with you. Some people are so dependent on their caffeine. They're going to hate you if you take away their caffeine.
Yes. So
I don't necessarily make them stop completely. They do drink black tea, or they will take a green tea extract first thing in the morning so that because a lot of my patients have anxiety, they're not getting that jittery effect of coffee. And so it makes a huge difference for them to slowly wean themselves off either with the green tea extract or with the black tea. Instead of being dependent on that coffee first thing in the morning, because you're literally starting out anxious. And then that's going to take you throughout the rest of your day as being anxious.
Well, and as I mentioned, some of it's a ritual, right? So it's not even so much the coffee itself. It's that I wake up, I have my hot cup of insert liquid here, like whatever warm tea, turmeric latte, like they just like that ritual of having the morning. So replacing it with tea or like matcha is another one that I really like to suggest. Then you're able to still get the antioxidants that you do get from coffee, but you're able to get a little boost in your energy without all of the full jitters of caffeine.
Well, what I love about the teas is they have that theanine that has that effect, the calming effect on your heart and protects you from that jittery. And a lot of people with anxiety, they don't distinguish between coffee jitteriness and anxiety jitteriness. And so when they're feeling jittery from coffee, that might send a signal to their brain. It's like, oh, you're having a panic attack or you're being anxious, when really it's the coffee. So it does make a difference when they reduce their consumption. And I've noticed for some people with anxiety, they don't do very well with coffee at all.
Yeah, most people, I think if we were to really sit back and analyze, most people probably, it's a no-go. Personally, I cannot do coffee. It keeps me up at night and it makes me anxious. And I've recognized that. And so I either go with like a chai latte, maybe with, oat milk and things like that, just enough to boost my energy, but not enough to make me anxious or jittery. Once my adrenals start to kind of kick back on though, like once I start with my adrenal regimen and they start to work the way they're supposed to, even that cup of tea, I don't necessarily need.
Yeah, and that's the thing. I mean, a lot of people are so dependent on these quick fixes without really looking at what are the root causes of what's going on with me. You mentioned with the thyroid, the testing, for example, a lot of the conventional medical professionals, they test us on this wide range and say we're normal when really the range should be on this end, right? Really low. What is the cap for the optimal thyroid level? Because it's like 1 to 5 when it should be.
Yeah. So the range for the labs is anything from basically 0.5 all the way to 4.5. So yes, it's almost it's a 4-point spread. And if you fall anywhere in there, then you are considered normal. There is something called subclinical hypothyroid that some people, like some endocrinologists, agree with and believe that it exists and others don't. But I treat subclinical hypothyroid all the time, where you still have all the symptoms. Your TSH might be within normal range, but it's not optimal. So optimal for me usually is anywhere between, for the TSH, is between like 1 to 2. There are some patients, if they don't have any of the thyroid symptoms, right? I'm going through the list, they don't have any. Then I'm looking other places for their fatigue, even if they're in that range. Typically, when they start hitting like 3, 4, like 4.5, getting higher in that range, they'll not only start to notice symptoms, but I'll start to be able to see, okay, I'm matching the lab with the person and not just reading the lab and ignoring the person.
Got it.
Which tends to happen where it's like, oh, it's range, you're good. And you're like, but I check all of the thyroid symptom boxes.
Right. I mean, it is definitely a delicate balance, and it does take somebody. It's like an art more than just the science, right? You have to kind of look at the person and balance it out with their symptoms and what they're going through.
Yes.
But since this is a mental health podcast and I want to keep it focused on mental health, as a naturopathic doctor, I mean, what role does hormonal imbalance have on anxiety and depression? You did mention a little bit, like you do see some of these impacts. So can you break that down as to why should I worry about my sex hormones and my other hormones if I'm depressed or anxious?
Yeah. So all of the ones that we've kind of gone over. So the thyroid, the adrenals, or the female sex hormones, or the male, if there's an imbalance in any of those, they can easily present as mood changes, right? Whether that be switching from one mood to the next, depression and anxiety. And typically with the female hormones, that estrogen and progesterone balance is very important. It's very key. And if that balance is off, and that could be with just one of them being depleted or in excess, it doesn't have to be both of them. Just that one can cause, again, those mood changes. Oftentimes with women, it's irritability. So think of like PMS irritability, but then like times it by 10. So just the littlest things will have them go off, and they think it's them, right? Their partner thinks it's them, but really there's an underlying imbalance that needs to be addressed. So depression, anxiety, and kind of the mood swings are all very common in that estrogen progesterone imbalance. For men, oftentimes with low testosterone, you'll start to notice that they're more, again, blah, which is more along the presentation of a depression. They don't know what's wrong. They just feel off. They don't feel like themselves, and they feel very flat and blah. Typically, if their testosterone is too high, which often happens with replacement more than just naturally, but you'll get that anxiety, right? That like roid rage picture, even though it's not full roid rage, it just might be that you're quicker to anger, right? And the anger might not be, again, I feel like we think of roid rage like big bodybuilders who just want to like yell at everything. But really what it can be is just, again, that irritability, that I'm on edge, that the little things will kind of tip me over, and then I'll be upset. With the thyroid, with it being low, oftentimes you get fatigue and it can be more of a depression picture. Now, on the flip side, something I haven't talked about is high thyroid. So you can have hyper, which means it's overactive, or hypo, which means it's underactive. Underactive, you'll get that fatigue and depression picture. Overactive, you'll tend to get anxiety because it can increase the heart rate, it increases the metabolism, and you get more of an anxious picture. Now, if you don't know it's the thyroid that's off, or you don't know if it's the sex hormones that are off, or you don't know if it's the adrenals that are off, you giving Xanax will help in the moment, but it actually won't be treating the root cause. Whereas if we just knew that the thyroid is off in either direction, then we're able to take those, treat it, and then resolve your issue a lot sooner than being on a bunch of different antidepressants and anti-anxiety medications.
Definitely all of that affects people, and that knowing the underlying cause is really important, because a lot of people, they take anti-anxiety medications, they take antidepressants, and it works short term, but then it doesn't. I mean, if medication alone for anxiety and depression was enough, I wouldn't be around. Nobody would need to talk to a therapist, right? Mm-hmm. Nobody would need to go to therapy at all, and you just take a pill. But it's not enough. And this is why I'm so passionate about looking at all areas. Just like you, when they come into my first session, they're surprised that I'm asking about their diet, about their sleep, about their stress level, about just their basic lifestyle. And then they're shocked that any of that has anything to do with their current state of being depressed and anxious. And I want to empower as many people as I can to really look at the root causes and not just focus on the Band-Aid approach. And one of the Band-Aid approaches that so many people are using now, especially with the legalization of marijuana, is using marijuana for calming their anxiety. I mean, short term it might work, but long term it actually makes anxiety worse. But what's really shocking is the impact it has on the male sex hormones, making them estrogen dominant. Can you talk a little bit about that and the side effect?
Yeah. So with the legalization of marijuana, a lot of people have been relying on it, like you mentioned, to treat those mental health disorders. But yes, it can decrease testosterone levels and increase estrogen. So in our bodies, estrogen and testosterone can convert back and forth to each other. So if I have a man who say I've put him on testosterone replacement, I am giving him something to block the conversion of that testosterone to estrogen. So basically, when you have someone who's on marijuana, you're enabling that conversion of testosterone to estrogen, which makes them more estrogen dominant. In a man, they might notice if they have more estrogen that they're more emotional. And it oftentimes is weepy, but it can be just, again, more emotional. They get upset rather easily. And instead of more of an anger picture, it might be more of like a sad weepiness. They also might experience things like nipple tenderness if estrogen gets too high in a man. So yeah, it's such a double-edged sword, because instead of people addressing the root cause, they are using it as a Band-Aid. And I think there's not enough conversation in that space about, a lot of times we only ever want to focus on the good. As a practitioner or the FDA or whoever, it's all, what are all of the benefits? And we tend to say, okay, well, let's focus here and let's not talk about any of the negatives. And when people have negative reactions because of the way that the medical model is built, which is you are an arm, so I look at the arm. You are a stomach, so I look at the stomach. You are a gland, so I look at the glands, but I don't look at anything else. And none of your providers talk. You tend to get this approach where things can easily be mixed. Whereas if someone was taking that full body approach, they could say, oh, well, you started this, your symptoms started here, so we just need to get you off of that and maybe support that testosterone pathway instead, which can be a much easier fix than now you're on 6 medications later, and we could have taken care of it with, one medication and maybe a few herbs and some diet and lifestyle changes.
And the scary part is with the marijuana use with men is, doesn't it also create softening of the features?
Well, because of the increasing estrogen.
Right.
So yes, you will get a feminized man, right? We want oftentimes men that have testosterone, that's, if they want to be male and that is the role that they are playing, you want more masculine features. You want more, again, that masculine energy, even just with having more estrogen in a man, you're getting things like nipple tenderness, more weepy. it's directly affecting kind of every aspect.
Yeah, and I think the only doctor that I've actually heard talk about estrogen dominance in men is Dr. John Gray. And he's the one that wrote Men Are From Mars, Women Are From Venus. And so I don't know why he's the only one I've ever heard talk about that. And a lot of men are not aware that they have even estrogen, or the fact that it can be dominant and that can feminize them.
Yes. And all of my, like I mentioned, all the patients that I've put on testosterone replacement are on an herb to block or medication, depending on how not everyone converts the same, right? So when we take a blanket approach to any treatment process, it's flawed because we're all individuals. I have some patients who deal really well with the herbs and that can block that conversion, but I have some that regardless of how much of the herb I have them on, they are just sprinting testosterone and estrogen. So in those cases, I need to then put them on a medication. But you also talk about the sperm changes, right? So in a situation where you're converting, sperm have to be, I think we don't think of this process being so specific, but sperm have to be the right shape, size, the tail has to be right, the head has to be shaped a certain way in order to reproduce. The tail has to work, right? It has to be able to swim fast enough. If we have feminized that process by having a man who is more estrogen dominant, you are not able to have that. So they'll do the sperm analysis, and you'll see in the morphology that they are misshapen. Their tail might be too short or too long, or the head is too round and not pointy enough. And so then you have an issue with male fertility, which when we talk about fertility, most of the conversation relies on the woman, right? She's too old, or what did you do? Do you have endometriosis or fibroids or whatever? But we should be analyzing both male and female patients when they come in and they want help with things like fertility, because it can very much be a male caused fertility due to that feminization of the sex hormones.
Now, that is becoming an issue. In 2021, they are really alarmed at the fact that there is a sperm issue going on, that somebody was saying by 2045, the population is going to significantly decline because of the sperm issue. Some are saying it could be COVID related, but could it be that because we were quarantining and we were depressed or we were sad or whatever, we were smoking more marijuana or not taking care of our bodies enough and maybe consuming more alcohol and taking more drugs? Could all of that have an impact on the sperm development and production?
Yes, but I think it started well before COVID was even an issue on the radar. Again, it's just something we didn't often talk about. It was just kind of like, you're a man, you should be able to have kids. When you ejaculate, something comes out, therefore it's perfect, right? You don't have any issues. But we weren't always putting it under a microscope. But fertility, both female and male, has been declining, I would say, for at least the last decade. There's been an increase in things like IVF and IUI. The amount of couples, just from a social perspective, that most of us know, before it was kind of like there wasn't a ton of people who had to go artificial insemination or IUI or IVF. And now I could probably name at least 5 or 6 couples in my social life. That's not even including professionally. And most of us can. But we've changed a lot of our food, right? We use Roundup, different types of pesticides, different types of environmental medicine issues like plastic use. People heat things up in plastic and styrofoam, and all of those things are endocrine disruptors. So they're going to disrupt our hormones. And if we look at it from a body burden perspective, which is like, so babies aren't born with a 0 level of toxins, right? That's why moms can't do certain things during pregnancy, because it concentrates in the fetus, right? The baby, it concentrates there. So say our grandmothers were at a 0, and then our grandmothers had lived their life, had our moms are born at a 5. And then our moms lived their life and now we're born at a 10. And then our kids are now born at a 15, unless you recognize it and make changes. So oftentimes if I have a couple who are interested in becoming pregnant, there's a whole process that includes, switching to a more organic diet, really looking at the things you're putting in your body, because it can have long-term effects. Removing things like mercury amalgams. That is another endocrine disruptor, which is something that was a very standard practice back in the day, but every time you chew, you're releasing mercury. So if you have all of these things, the lotion you're putting on, the food that you're eating, the water that you're drinking, all disrupting your hormones, and it has been my entire life, so at least the last 30 something years. So of course we're going to see a decline especially because our world just keeps continuing to kind of become more toxic. So it really does have to happen on an individual basis. Your body should be able to cleanse and should be able to detox all of these things. But again, you have to know that it's an issue to begin with, which is where the conversations like this kind of help with that.
And it can be overwhelming, and that not only is it our environment and that everything that we're surrounded by, pesticides, environmental toxins, the plastics, the perfumes, the chemicals in our makeup and our lotions. But on top of that, our lifestyle isn't contributing to it either. So we're pushing our bodies so hard and then expecting it to function when we want it to, expecting it to form a baby when it's supposed to, expecting it to lose weight when it's supposed to, not realizing we've really weighed ourselves down and we have to do the work. So are there some tips that you have that can make this process a little bit easier of making us be healthier and create some more balance in our life?
I like to take it one step at a time with patients. So it kind of goes back to that caffeine conversation before I just like pull all of your caffeine, because people would be very upset with me. Usually I just take a step-by-step approach. So first, environmentally is probably the easiest in the sense of stop using things like styrofoam, especially styrofoam for things like hot coffee or heating food or takeout, right? If you have to take out something from a restaurant into styrofoam, try to let the food cool down before you put it in the styrofoam, and don't take it home and reheat it in that same container. Stopping the use of heating things in plastic and decrease your plastic use overall. Not only is that great for your own health, that's great for our environment. So certain things like that are easiest. And then just take it one step at a time. So you have a lotion, read the back, things like parabens, phthalates, BPA, all of those are known to be endocrine disruptors. So reading the label of things and then taking your time and saying, okay, well, once I'm done with this lotion or I'm done with this body wash, I'm going to give it away. Most of us don't have the ability to just like literally throw away everything in our house and start over. So I like to take those step by step. Candles is another really easy thing to not use anymore, to not burn, because they also release environmental toxins. The Febreze that you spray in your house, or the plugins that scent the house when we talk about things like fragrance and having an issue with environmental medicine. Those are like little small things that you can do. Switching and just buying the Dirty Dozen is something that is on the Environmental Working Group is the name of the website, but they have a clean 15 and a Dirty Dozen. So the Dirty Dozen are the 12 most pesticide sprayed foods. So start there with your buying organic, right? And if you can't afford it, and it's better that you eat a non-organic apple than to eat a bag of Cheetos. So I have people start making these conscious little choices to overhaul their life, because it is overwhelming. You know, water's another easy place to start. So kind of taking a look at your life, see the things that you're doing, right? What you're consuming, what you're buying, what you're putting on your body and in your body, and then one at a time. So you might not, again, be able to overhaul all of your makeup. Makeup's really expensive. But you might say, okay, well, after I run out of this foundation, I'm going to find a better foundation. And I'm out of this mascara, so I'm going to switch over. Just taking it day by day.
The Environmental Working Group, the EWG.org, I believe, is a really wonderful resource. I will put that in the show notes because I feel like everybody should go in there and support them and learn from them. But they also have a Skin Deep website, which you can actually put in your lotions and your cosmetics and see what the toxicity level is on that. And then it'll give you an idea, like you said, okay, I'm going to use this until I'm done, and then I will replace it with something else. I buy way less now. I spend way less because before, when I would buy drugstore items, I would buy a whole bunch of things, like a whole bunch of eyeshadow or makeup or whatever. Mm-hmm. And now I'm more selective. I might pay a little bit more, but I'm not buying as much, and it's cleaner and it doesn't have as many chemicals in them.
Yeah, there's a local, so EWG, they also have the Skin Deep app. Mm-hmm. And with that, I believe you can take pictures of the barcode. So like if you're in the store and you're curious, you can just take a picture with the barcode and see what it is. Easy things to switch over for me when I first started this a while ago was like toothpaste is really easy to switch over. Deodorant is easy, but you have to find the ones that work for you. From a breast cancer perspective, though, it does lower your risk if it doesn't have things like aluminum in it. Right? Because we have lymph nodes in there that drain directly from our breast. So we have to be really mindful of that. But you do have to kind of trial and error with natural products to figure out what works for you. And that's what I did when I started, I said, okay, I was sitting in class and we started talking about environmental medicine. And I was like, what? Like, I can't go into the world. Like, what am I supposed to do? And so I said, all right, when I run out of this, I'm going to replace it with something cleaner. And I did a bunch of research and tried to find people that either, had my skin tone or companies that had my skin tone, because that was another hard thing with makeup, and just trying one thing at a time. And there was definitely times where I bought a mascara, it flaked all over my face, and I was like, okay, that is not worth me waiting. I'm going to recycle this. But you do kind of have to give it a try, and then you easily find your groove. Locally, there's a company called Citrine Beauty Bar. They're right at the Biltmore Hotel, the Biltmore Fashion Center, Fashion Square, I think is what it's called. And it's all natural beauty. So they have face washes and things like that, but they also have lipstick and mascara and foundation and all of that stuff. Like a MAC, but healthy.
And it used to be so hard to do that. 10 years ago, when I became aware of parabens, it was more than 10 years ago, parabens and phthalates. I remember going to Sephora and saying, I want something that's clean. I don't want any of that. And they're like, don't worry about the parabens. It's just a tiny little bit and it's not really going to affect you. But I'm like, if I have parabens in my face wash and then in my shampoo and then it all adds up. And yes, maybe in that one little product, and this is why they can get away with not eliminating it, is because for one product, it might not have as much of an effect on you, but it builds up on all the chemicals that we're putting on our body on a daily basis.
That's exactly what I tell people when I've gotten pushback, when I've asked, okay, well, it's like, well, it's again, such a small amount, but if it's in everything, then it adds up to be a lot. And the reason why it doesn't get checked by the FDA or anyone regulating it, 'cause the cosmetic industry is regulated by them, but it's because they're only looking at the one product. They're not thinking, on average, women use at least 10 products on their face. So with all of these 10, let's add that up, is the level still safe? Another thing that I kind of wanted to mention really quickly, because we touched on it, is fat. So we made a comment about kind of the feminization of men and kind of realizing that male fertility is a really big deal. But we've also normalized things like dad bod being really hot. Like, oh, he's got a belly and I love it. But what we aren't having a conversation about is that fat is an aromatizer. So fat will give you more estrogen. It aromatizes things like testosterone to estrogen. So we have to be mindful that fat plays a role when it comes to our hormones, and fat also stores our toxins. So if you have a big buildup and you're not eliminating properly, right? So you're not having regular bowel movements and the liver's not working effectively, your body doesn't want to poison itself. So it's going to be like, where can I stick this extra fat or extra toxin? And it's going to say, oh, I'm just going to put it right here in the belly, and it stores it there. So often you'll get people who really struggle to lose weight and they're doing everything right, but your body's not silly. It's not going to poison itself. You're not eliminating properly. So we have to get that on board before you're going to notice those pounds being lost.
So interesting. Our body is so amazing and it's so wise, and it will heal itself. It will take care of us. It'll do what we need to. We just need to give it the opportunity to do so. One thing I tell everybody, all my patients that I work with, is we take better care of our phones and our cars than we take care of our bodies. We need to switch that, and we need to prioritize ourselves, and we need to make sure we're doing everything we can to make sure our bodies are running smoother than our cars. They're doing what they're supposed to.
What's the point of having a Tesla if you're so sick you can't drive it?
Exactly.
It doesn't really matter at that point. You could have any car in your driveway.
But also the Tesla might cost like $100,000, but your body is worth way more than that.
True.
And prioritizing the $100,000 over the millions that your body's worth.
I think we've just made it to where people think if they take a pill, it equals health. Right. And it's like, oh, well, I'm taking XYZ. My doctor said I'm fine. When I start telling people, because I take a more individualized approach, even with diet. So there's different strokes for different folks, right? Different people feel better on different types of diets. But when you have something like cardiovascular disease, and I'd say, oh, well, like you should go plant-based because there's been plenty of research, like more than enough research backing plant-based diets and reversing cardiovascular disease. And I'm told that that's extreme, but like having a quadruple bypass is not extreme. Like being on 6 different medications to manage your condition, not treat it, not reverse it, to manage your condition is not extreme. But me telling you to eat more fruits and vegetables is extreme. Like as a society, we've stopped thinking about how the body works and supporting that. And instead of thought, like, well, we know better, we're just going to go on these pills. But, you're able to sustain life, but what's the quality of life that's sustained also needs to be addressed.
Right. We're not thinking about ourselves 20, 30, 40, 50 years from now and what our life is going to be like at that point. And we need to really invest in ourselves so we can be as healthy and functional in our later years as we are now. So with everything that all the information that you've been learning over the years, what would you tell yourself to your younger self? What advice would you have for your younger self about hormones and hormonal balance if you can go back?
Yeah, that's a really great question. As a woman, because obviously I'd be talking to myself, it would be to track your cycles. That's like my number one thing that I tell everyone. They've got an issue. I'm like, are you tracking? When was your last one? Do you know? How much did you bleed? But aside from hormones, I would say that my personal belief is that everyone should be their own health advocate. And that doesn't mean that you know more than the doctor. It's not that. It's just, I would tell myself to not be afraid to ask questions and to not be afraid to, if my provider wasn't giving me the answers that I needed or kind of seemed like they didn't want to answer it, to find a different provider. As women, I feel like we're shuffled on things like birth control all the time, and that can have long lasting effects on our hormones. And so I would want to know the pros and cons. And I would be kind of adamant about wanting to know, okay, what are the benefits? What are the risks? Because at 21, most people aren't thinking about having a baby. And there are certain things that you're doing to affect that process 10 years from now. And so then you get a 31-year-old or 35-year-old who's ready to have a baby, and they're now having all these issues. And oftentimes it's choices that were made in early adulthood. So just ask questions, be your health advocate. Don't do anything blindly, and to kind of protect your hormones and eat and live and move, knowing that is very much a symbol of female health, and it matters.
Very good advice. My goal is to encourage every patient that I work with and everybody that I work with online to advocate for yourself, educate yourself. Not that you necessarily know more than a doctor, but if you are educated enough, you will know when you're not getting the right care and you're not getting the right information. And so definitely look and find the right practitioner. Keep searching. Don't give up. And then also with everything we've been talking about, it's, obviously this is all for educational purposes only, and to work with a trained, trusted medical professional and get the guidance that the people need to get on the path of health and wellness. Where can people find you and connect with you if they have any questions or want to reach out?
Yeah. So my website is just drbrandymoore.com. I'm also on Instagram, Facebook, and TikTok, all at Dr. Brandi Moore. And then from my website, if you wanted to work with me or know information, it's all of that stuff is there. And then on every Tuesday, I have an episode go live on my podcast called the Pretty Healthy Podcast. So lots of different ways to connect and interact with me.
Congratulations on starting your podcast.
Thank you. It's been exciting.
I'm glad that you're doing that. That's awesome. So thank you so much for being here and having this conversation with me. I think that we need to continue to have this conversation about hormones. I've had several episodes about this, and I have this conversation with my patients in practice. I just feel like it's not enough even then. We still need to keep talking about it.
I agree. Thank you so much for having me.
Wasn't that amazing information from Dr. Moore? Now, I want to hear from you. What did you learn about hormones in this episode? Head on over to transforminganxiety.com/35 to leave a comment and share your responses, but also to learn more about Dr. Brandi Moore. As always, be sure to work with a trained holistic or integrative medical doctor before starting any of the treatments mentioned during this interview. If you haven't already, you can show support for the Mental Health Break podcast by subscribing wherever you're tuning in from today. We have some great interviews lined up, and you don't want to miss a single episode. Subscribe today so you get notified when new episodes drop. I can't wait to see you here next week. Same time, same place. Bye for now.